And the last section is moral hazard. Question 31. Which of the following best describes moral hazard? And so the answer here is B. People tend to take more risks when they have insurance than they do without it. A is adverse selection. As the price of insurance rises, only the riskiest individuals continue to buy insurance. And then C rather is just the definition of basically risk aversion and the demand for insurance. If you're risk averse, you like certainty, you're more likely to buy insurance than somebody who's risk loving who loves uncertainty. And so the answer there is B. 32, all of the following must be present for moral hazard to exist, except, and so we definitely need price distortion. We need insurance to cause the price of an activity to go down in order for people to do more of it than would be socially optimal. We need price sensitivity. So when the price goes down, we expect that people are going to increase their quantity demanded. And then C, asymmetric information. We need the fact that the insurance company can't charge you more for every risky behavior you take. So, for example, if the insurance company knows, if a car insurance company or a health insurance company knows, for example, when you get on a motorcycle, then they could potentially charge you a higher premium for every mile that you ride on that motorcycle. But because they can't observe that, they're charging you the same premium regardless of whether you're taking this risky behavior or not. And so A, B, and C are all necessary components for adverse selection, or sorry, moral hazard. And then D, competition between insurers, doesn't really make a difference, right? You're going to have moral hazard whether there's perfect competition in the insurance market or even if you had a monopoly in the insurance market. 33. Which of the following best characterizes ex ante moral hazard? So, ex ante moral hazard is that when you have insurance, you're taking more risks that increase the likelihood of an event before it happens. So, for example, A would be an example of ex ante moral hazard. Because you have health insurance, you're more likely to eat unhealthy foods because you're not as concerned with the cost of healthcare because you led this unhealthy lifestyle, right? So if you have a heart attack or diabetes or something like that, because you have insurance, it still sucks if that happens, but it's not as expensive to you as if you didn't have insurance. So if you didn't have insurance, you know you couldn't go to the hospital, you can't afford these bills, you're more likely to be careful, you're more likely to eat a healthier lifestyle. So B, C, and D are all examples of ex post moral hazard. Ex post moral hazard is when after an event happens, you have insurance, and that insurance is going to pay for procedures, right? And it's going to pay for procedures that you would not have necessarily gone for if you didn't have insurance. So, for example, you let's say break your leg, you can treat this with casting or you can treat it with surgery, and let's say that they're equally effective, but surgery has a shorter recovery time. If you didn't have insurance, you'd probably just go with casting, but because you have insurance, it'll pay for it, you go for the more expensive surgical treatment. So that would be an example of ex post moral hazard. Another example is, going to the emergency room for a non-emergency condition. Certainly has a societal cost, right? We don't want to be taking up the space and the time at the emergency room for true emergency situations. If you just go in and you got like an earache or a stomach ache or something like that, especially consider now, with everything's going on. I mean, absolutely, if you are not truly in an emergency situation, don't go to the emergency room. But in these sort of non-pandemic situations, you might have a situation where because you have insurance and it's going to cover the cost of that emergency room visit, you're feeling a little sick, you're a little bit worried about it, you go to the ER as opposed to, let's say, waiting a couple of days to go see your family practice doctor for that. Now, you wouldn't do that if you didn't have insurance because the out-of-pocket expense for an emergency room visit without insurance is like thousands upon thousands of dollars. You're less likely to do that. And then D, you opt for more expensive brand name drugs rather than generics when your insurance covers both. So if you got this prescription drug benefit and that drug benefit's going to cover the brand name, you might as well go for it, right? As opposed to just getting the generic. The generic might be equally effective. It might have the exact, generally almost exactly the same chemical makeup, does the same thing. And if price was the only factor, you'd probably go for the generic. But because the insurance pays for it, you're more likely to go for that brand name, even though it's not necessarily any better. 34. Which of the following best characterizes ex post moral hazard? So again, ex post is when you change your behavior after the event happens because insurance lowers the cost of treatment. And so A would be ex ante moral hazard. You're skipping a flu shot because you have insurance. So you're thinking, oh, if I get the flu, I can at least go to the doctor. They'll treat me. They'll give me antibiotics. Or actually, antibiotics don't do anything for the flu. But you'll go to the doctor and you'll get some treatment. You have comprehensive car insurance, so you drive more recklessly. You're not as concerned about the cost of fixing your car if you have good car insurance. D, if you run a bank that's deemed too big to fail, and so you aggressively, seek out high risk, high return investments. The idea being here that, if you take this gamble and it pays off, you get to keep everything. If it fails, well, the taxpayers are going to bail you out, so you might as well. So A, B, and D are all examples of ex ante moral hazard. These are actions that you take because you have insurance that have now increased the likelihood of that bad event happening. So you're more likely to get the flu, you're more likely to get in a car accident, and your bank is more likely to need a bailout. C, however, is ex post moral hazard. So you've already gone on into, let's say, a financial crisis or your business is doing badly. Now you could either try to reorganize, lay off some staff, figure out a way to cut costs, increase revenues, or if the bankruptcy laws are really generous, you just declare bankruptcy. You write off the business, you get the big tax break, and you let somebody else take care of it, and then you can start over. And so that would be an example of ex post moral hazard. 35. The social loss associated with moral hazard is going to be largest when, now the social loss is going to be a function of price distortion, so how much insurance lowers the cost of an action, and price sensitivity, how responsive you are to that price distortion. And so the biggest social loss is going to happen when we have large price distortion and large price sensitivity. In fact, you multiply those together to give you the size of the social loss. 36. What is true about the social loss associated with moral hazard? And again, we just said that, basically the social loss is a function of both price distortion and price sensitivity. So the answer here is going to be D. If price distortion doubles, price sensitivity doubles, because the social loss is a function of both of those. Actually, the social loss is going to quadruple. It's going to be 4 times as big. To think about this, suppose that your price sensitivity didn't change and price distortion doubled, then we'd expect the social loss to double. If price distortion doesn't change, but price sensitivity doubles, then of course social loss would double. If both of those double, then the social loss, again, is going to be multiplying them together, is going to quadruple. All right, 37. Which of the following would be least susceptible to moral hazard? So again, this goes back to the question of price sensitivity, right? And so if people are very price sensitive, then the social loss is going to be really big. There's a lot of moral hazard there, right? So the price goes down a little bit, you do a lot more of it. And so you're more price sensitive when the action that you're doing is very substitutable. So for example, if people see motorcycles and cars as perfect substitutes, then by insuring against motorcycle accidents, you've reduced the price of motorcycle riding. And so what that means is that if people are completely indifferent between riding a car, driving a motorcycle, then if the price of riding a motorcycle goes down, then a bunch of people that would have otherwise driven cars are going to switch over to motorcycles. And so that would be a big loss for moral hazard. Heart disease, when your risk of heart attack can be reduced through diet and exercise. So again, this is one in which you can actually do something about this, right? So if you didn't have insurance and you knew that you were susceptible to heart disease, well, you might be more likely to diet and exercise without insurance, because a heart attack is a really expensive treatment, as opposed to if you did have insurance, you still don't want to get a heart attack, but the cost is not going to be nearly as high. And then C, Huntington's disease, since it's a condition that's almost entirely determined by genetics, basically there's no substitute, right? There's no way really to prevent it. And so it doesn't really matter, what you do. If you're genetically predisposed to Huntington's disease, you're more likely to get it. If you're not at all genetically predisposed, then you can live the least healthy lifestyle and you're still not going to get it. And so here, we're not really worried about moral hazard with Huntington's disease, because your own actions themselves won't change the likelihood of you getting it. And so that's why C is the answer here. That's the one that's least susceptible to moral hazard. 38. Which of the following is true about deductibles? So a deductible is basically the amount that you've got to spend out of pocket before your insurance kicks in. And so, for example, if you have a $1,000 deductible in your health insurance policy, the first $1,000 of medical expenditures that you encounter are all coming out of your own pocket. And it's not until you spend $1,000 that insurance kicks in and starts either paying all of it in the case of a full insurance plan, or you have a copay, or there's a co-insurance, something like that. Now, an advantage of a deductible from a social welfare position is that it actually reduces some of the social loss from moral hazard, and it reduces it by an amount equal to the loss of consumer surplus resulting from health expenditures below the deductible. And so we showed that graphically, but essentially what it effectively does is, because you are paying that money up front for that initial part of your health expenditures, effectively you're paying that first part of the social loss from moral hazard. Any health expenditures above the deductible are still subject to moral hazard, and there's still going to be a social loss. You could set the deductible so high that it completely eliminates moral hazard, but in that case, you might also be generating even bigger costs by effectively having people that are uninsured if they're spending on average less than the deductible. And so this is why, this is sort of a balancing act. You don't want to set it so high that you're completely basically non-insuring people, but you do want to set it at a certain point so that you can reduce a little bit of moral hazard. And so A is the answer here. Let's go through the other ones. B, a low deductible is actually going to reduce the social loss from moral hazard less than a high deductible. C, coinsurance will always reduce the social loss from moral hazard more than a simple deductible plan. We don't know that for sure. As we said, you could make a really big deductible that completely eliminates the social loss from moral hazard. At the same time, you could make coinsurance so high. So basically, if you had 100% coinsurance, which basically means you pay 100% of every medical bill, that also eliminates the social loss from moral hazard. So there's not any guarantee which is bigger than the other. It all depends upon the specific details of the plan. And then D, setting a deductible that eliminates moral hazard will always improve social welfare. No, we don't know that for sure, right? Because if you set it so high that you've eliminated moral hazard, then effectively what that means is you've set the deductible above the average healthcare expenditures of all individuals. And we still want people to be insured, right? I mean, people like insurance, people are risk averse, and so there is some social benefit to insurance, but perhaps it's not full insurance in the presence of things like moral hazard. 39. Which of the following is evidence against? Which of the following is evidence of ex ante moral hazard? So again, ex ante moral hazard is when people are taking actions with insurance that make them more likely to experience that problem, health risk, or whatever it is. So the answer here is A. Insured households in Ghana were less likely to use mosquito bed nets, and so if you have health insurance, then the cost of contracting malaria is not going to be as high as if you didn't have health insurance. And so the story here basically is that if you're an insured household in Ghana, you get the mosquito bed net, you're less likely to use it, at least as a bed net. You're actually more likely to use it as a fishing net, is what people found. And because the cost of contracting malaria is not as big, because you have health insurance, you can go to the doctor. And so that's an example of ex ante moral hazard, where those insured households in Ghana are actually now more likely to contract malaria because they are, because of insurance, less likely to be using these bed nets. B, Stanford employees reduced their doctor visits after 25% copay was instituted to their health insurance. Well, that would be an example of ex post moral hazard. Now it's more expensive to go see your doctor, so you're less likely to do so. C, private insurers in Germany introduced deductibles. Customers greatly reduced their health expenditures. Again, ex post moral hazard. Then D, Canadians with prescription drug coverage more likely to visit the doctor to get prescriptions rather than over the counter medication. Again, that's an example of ex post moral hazard in the sense that because they have this prescription drug coverage, they're more likely to get the prescription medication as opposed to the much cheaper over-the-counter medication. Well, much cheaper without insurance. With insurance, sometimes the prescriptions are actually cheaper than the over-the-counter medication to the customer, not cheaper overall. The insurance company is paying part of it. Okay, and the last question is question 40. Which of the following is true according to Pauli's model of optimal insurance? And so this is the model in which basically the premium is rising with the level of coverage. And so that's a function of moral hazard. We know because the more insurance coverage you have, the more moral hazard is going to kick in, which is going to drive health insurance premiums up. So if you're taking riskier actions with more insurance, then you're going to pay a higher premium as a result of that. And so as insurance coverage increases, premiums are going to go up. And as premiums go up, there needs to be then this trade-off between how much insurance coverage do I want versus how much am I willing to pay in the form of a premium. And so the optimal insurance policy is going to be one that's probably not full insurance. It's going to be partial insurance. And you're going to end up paying a higher premium than you would in the absence of moral hazard. So the answer here is going to be C, the socially optimal plan in the presence of moral hazard has a lower level of coverage. So it's not full coverage because full coverage is going to be super expensive. It's going to be partial insurance, But even that partial plan is going to have a higher premium than it would if there was zero moral hazard in the market whatsoever, right? And so that's why the answer is going to be C here. It's not A, because the socially optimal insurance plan that completely eliminates moral hazard is the one that doesn't give anybody insurance. But people like insurance, right? There's a social benefit to having insurance. And so we don't want to have zero coverage. We want to have some partial coverage at least. But it's probably not full coverage again because the premium is going up and going up rapidly as coverage approaches full. Okay, and so the answer here is going to be C. Okay, so those are the 4 sections on the exam. It's all going to be done on Canvas. There's going to be multiple choice. There's going to be short answer. You're just going to be typing stuff in. So we won't necessarily have graphing questions that you have to draw, but that doesn't say that there aren't going to be graphs that you are going to have to potentially manipulate a little bit. And so you do need to know those diagrams. You won't necessarily have to draw them, but you're going to have to know what they look like and how they function. Other than that, I'm going to give you an hour and 20 minutes to finish the exam. I'm probably going to give you like a 5-hour window to start it and finish it. But once you start it, you're going to have an hour and 20 minutes to finish it. So there's going to be more details posted to Canvas about the details of the exam. But it's going to take place, again, on Wednesday. I'm going to have a Zoom window open during the exam time that if you need to ask me questions, you can log into that and you can ask me those questions. Other than that, good luck. I hope everybody is staying safe and healthy. And I will see you virtually on Monday, what is it going to be, the 23rd? And hopefully after that, I'll see you after spring break. All right, bye-bye.